Pat Barron. Have any of your patients on the Losartan complained about hair loss? What is the best blood pressure meds for black women? It's not necessarily black women or black men. Losartan is a class of drug called an angiotensin receptor blocker, or an ARB. It is a very good choice. I have not heard of people complain about hair loss, but it doesn't matter whether I've heard about it. If you're taking it and the hair loss is happening to you, then the side effect is 100%. That's all that matters. But understand this: oftentimes, things like arthritis and high blood pressure, they all come along at the age in which a woman or a man starts to lose their hair. It's aging, the alopecia of aging, if you will, male pattern and female pattern baldness that will happen. So the medication gets credit for what was going to happen, regardless of whether you started that medication or not. So hair loss is thyroid disease until proven otherwise. If you get your thyroid evaluated and they are normal, then you start to look at the next cause will be anemia, and then after that I would look for other issues, such as fungal infections of the scalp, seborrheic dermatitis, those sorts of things. So it's very important that you differentiate between scarring hair loss and non-scarring hair loss. Non-scarring means that the hair follicles are still intact. You can lose hair, but it can come back and it will grow back and it will be the same quality type as you had previously. Scarring means the hair follicles are now covered up. There's a true bald spot. There's no place for the hair to come out, so the hair doesn't grow, and you will end up, that's a permanent loss in that area. So it's very important to make that differential and to work with someone who understands not only hair loss, but hair loss in black women. Not just hair loss in men or women or whatever. There's a special, unique circumstance, things that are more common in African American women, and you want to make sure that your hair, which is already delicate, because all the things we have to do to well, or do not have to do, but do to hair, very important that you get that checked out. So find you a dermatologist that specializes in black hair, and just Google that combination of things, and you will find people that, and find, look at before and after cases, people that they have treated before, and that will give you some insight as to what's going on with that.